Okay, welcome everyone. Welcome to the NHS Fair. This first panel is for social prescribing and working in the care sector. And the purpose of this careers panel is to give some insight into the breadth of careers that are in the NHS by meeting some really interesting individuals who are working currently in the NHS. Now, this session will be meeting a group of professionals working within the social care sector. And like the rest of the NHS, there are a variety of roles. And today we have representatives from a few of these roles. Okay, so in order to ask your panelists questions, please use the Q&A function on your screen. We've had some questions submitted already, so we're going to be asking those first, but hopefully at the end we'll have some time to ask some really great questions that you have for our professionals. But before we go into the questions that we've had submitted already, I'd like to welcome the panelists to introduce themselves and tell us a little bit about themselves, their role and their journey into their current career. So perhaps we start with Louise, first of all.
Yeah, thank you very much, Jake. Hello, everybody. My name's Louise. I'm a nurse by background, and I've worked across in the NHS and in adult social care as well. At the moment, and I'm also work for mental health and general nursing too, but at the moment I run a team of nurses in across the 5 boroughs in north central London, and we are putting digital technology into nursing residential homes, learning disabilities and mental health homes. So it's a very exciting time. The reason that I'm a nurse is because I fell into it accidentally. I wanted to do something else and I was rejected, and my careers teacher said, "Why don't you try nursing?" And I said, "You're having a laugh." And here I am, about 38 years later, I'm still here. So she must have seen something that I didn't.
Brilliant, thank you, Louise. Yeah, we look forward to asking you some more questions about that later on. Next, can we have Nathan, please?
Hi everyone, good afternoon. Yeah, my name's Nathan Cole. So yeah, I work in workforce with NCL. So yeah, that's the boroughs of Camden, Barnet, Haringey, Islington and Enfield. So that's basically building recruitment, retention in social care in those boroughs. I also run the Proud to Care portal. That was essentially, I started off in my role in social care as an apprentice for Camden, running a little website, Proud to Care, to help promote social care. Obviously, COVID has happened, where my workload, as with many other people on this call, I can imagine, expanded infinitely. And yeah, so now I'm working seconded with London ADAS, helping to try and build a London Social Care Academy as well.
Brilliant, that's really, really interesting. Thank you, Nathan. We'll get back to some of that later on as well. Okay, Caitlin, could you go next, please?
Yeah, hi, thank you. It's really great to be here. My name is Caitlin. I'm the Social Prescribing Link Worker Manager for Barnet in the Borough of Barnet. We have 7 PCNs. We work across the primary care networks, so working in the local GP surgeries across the borough. And there's 15 social prescribers now embedded in Barnet. So we're a nice big team, which is great, and we're growing still. Social prescribing is a relatively new concept to the NHS. And so what our service is primarily for is to help reduce the dependence that people have for any non-clinical or medical needs that they go to see their GP or other healthcare professionals about. So what we find is that our GPs then refer people who present these either sort of social or economical issues to a social prescriber, who then can take time, spend sort of one-to-one time with that individual, discuss what matters to them, discuss their needs, and then basically from that appointment, then they can work on follow-ups, but also signpost them and prescribe them to the local community services that are much suited and better equipped to manage whatever their sort of non-clinical issues are. And so my role is to really help promote awareness of the service in the borough, so really embed it into the community, build strong partnership networks with our community services as well as the healthcare professionals that refer. I support our team members. Obviously, we see quite a lot of complex cases, particularly with COVID. So sort of supporting our team members through those training, and then also reporting back on the benefits and the outcomes of the service. So,
wow,
yeah.
that sounds really great. And yeah, social prescribing is something we're going to ask a little bit more about, and get to know a bit more about your role too. Lauren, please, could you introduce yourself?
Hi, welcome. Hi everyone. So I'm Lauren, and I work alongside Caitlin as one of the social prescribers in Barnet, one of the 15. I cover 7 surgeries in the part of Barnet that I sort of look after. Been doing the role for about a year and a few months now. It's really interesting. I'm sure we'll go like more into it in a bit. But I'm basically there to be that feed of helping people in their well-being connect from the GP surgery out into the community, to try and sort of help the NHS and the pressures that we find. So yeah.
That's really great, and it sort of just leads us a little bit into our first question, actually. So why don't we start with you, Lauren? Yeah, so you're a social prescriber. So do you have to be medically qualified to be a social prescriber, or do you have to be qualified as a social worker, or what are the qualifications that you need for your role?
Well, I'd say at the moment, like where it is still fresh, that they haven't sort of like cemented that sort of qualifications. However, that will really help you, because it will help you sort of be able to relate and talk to patients, as you will come across a lot of different characters and people from different backgrounds, and it's really important that you follow your safety and their safety and all of those regulations, but also know how to communicate and motivate them, and be able to sort of build up that connection. So sort of having a background in social care work or psychology or anything that side is going to help you a lot, because there's a lot of things that go on behind closed doors of how like referral routes happen, and how you sort of escalate or pass on to the correct bodies. So any sort of background and understanding is only going to help yourself and obviously everyone else that you support.
Brilliant, thank you. And Caitlin, do you have anything to add to that, or maybe tell us a little bit about how you yourself got into being a social prescriber and the route that you took?
Yeah, absolutely. So yeah, as Lauren said, there isn't actually any set qualification. What we look for when we're hiring social prescribers is a lot of characteristics that come through. So really, being able to show empathy, listening skills, that real caring nature is a big part of the role. But also, like as Lauren said, anyone who's coming from either health promotion, social care, even like welfare and advice, like support roles are really a really transferable skill. And so that would be something we would look for. But I actually came from like a health promotion background, and so well-being coaching and things like that. So.
Cool. Oh, great. Yeah, so that's a strong link there. Okay, well, thank you for that. And just one more question about actually social prescribing. Is it something? Where can you go through that career? Is there anywhere does it lead to anything else? And is that kind of where your career will sort of naturally take you?
There's a lot of scope actually. It's like I said, it's a new role, but what it does is it opens doors both through the community and also through the NHS. And we do a lot of partnership work with things like care navigators, health coaches within the NHS, but we also have a lot of services that we partner with. So there's a lot of scope for taking on more kind of leadership roles within social prescribing, but also through networking and collaborating. So collaborating. So that's kind of how it can progress.
It sounds like a really, really interesting career as well. So yeah, it's something that I didn't really know about until I was having a look for this panel, and I'm sure some of our participants will be really interested to hear a little bit more about it too. So I'm just going to move on to Louise. Actually, we've got a question for you. So what could you tell us the difference between, it's quite, so it might be a difficult one and quite a long one, but could you tell us the difference between working in a nursing home and working in a care home?
Oh, okay. Good, very good question. Thank you for that. So a nursing home has nurses, and a care home, which you're best to call it a residential home, will have no nurses. So we've got residential homes, which are often learning disabilities, mental health, and older people. And then we have nursing homes that have older people with more complex health needs, and there has to be nurses there to look after them.
Okay, and it's as simple as that. I like it. Thank you very much. Straight to the point. Okay, so that was just a very quick one for you, Louise. Okay, Nathan, there's one for you here. There seem to be so many jobs in the care sector, and with lots of different qualifications needed. So how can you go about finding out about different roles and some of the opportunities that are there for work experience in the care sector and things like that?
Okay, well, sorry, I'm clearing my throat. There are loads of opportunities out there if you just look for them in theory. So, I mean, Proud to Care website, which is predominantly a North London site, the Proud to Care North London. We advertise just the different roles, that we showcase different roles. We've got case studies on there, as well as Skills for Care. I believe they have a vast library of all the kinds of roles that are out there and the ones that are available. Yeah, I mean, you just have to really look, really. There's just so many resources that you can go, possibly, obviously not right now, but pre-COVID, you can speak to the managers possibly and find a vocation, a voluntary position, or some kind of procedure. The care sector is a very much values-based environment, so they want to know you, they want to see you as well. So I mean, it's really just getting out there, I would say.
Brilliant, thank you. And I'd like to extend that question to Louise, actually, because you've worked in the care sector for so long. Also, what advice, if any, would you give to someone who might be thinking about a job in a career in the care sector, and what sort of experiences should they be looking for in order to sort of push them in that direction?
Well, to work in the care sector, I think that you need to be somebody that is obviously caring, kind, compassionate, all those really important words, because you're going to be looking after somebody's mum or somebody's dad or their brother or their sister. And these are really vulnerable people. So you got to have a bit of something extra. And I think everybody's got it, but we just find it at different times in our life. So some people have it when they're really young, and we'll have some people on this call that will be absolutely up for it and ready. And other people find that more when they get older and they've had some life experience. I'd say that the care sector has, as Nathan said, loads and loads of different jobs. And you can start anywhere. So there's, before COVID, there was loads of volunteering and people could do volunteering. It's a bit more tricky now to get the feel of it. But, there's lots of weekend jobs and holiday jobs. There's lots of people that I know started in the kitchen and then ended up managing a home or starting as the cleaner. But for me, I started that I was a healthcare assistant, and I got to learn about what it's like to be a healthcare assistant, which I've never forgotten. And I've always kept that with me throughout my career, because we're all the same. We all want the same thing. We all want great care for the people we look after.
That's wonderful. It's wonderful to hear as well, because I'm sure that a lot of the participants watching and everyone really has someone in their life that is being cared for by people in the care sector, and it's great to hear that you all have these values that are so important to have to do that job. So thank you very much. Just something that keeps coming up, and I know it's 2021. It was going to come up a lot, but COVID has been mentioned a few times. I just wanted to get a little bit of idea how your roles have changed in the last year or so. Very quickly, why don't we sort of pick one from each? So one of the social prescribers, maybe you could tell us how it's changed yours, and then Nathan and Louise could tell us.
I'm actually going to let Lauren take this one. So our service has been put on hold for some of the time doing the vaccine support, and actually Lauren can tell you about her experience of that.
Thank you.
Yeah, so social prescribing has been really interesting because we've sort of been alongside the GPs on like the front line with sort of sorting out COVID. So last year when COVID first hit, we were doing all the welfare checks. So we were calling all of the shielded patients and making sure that they had that community support. So by that, we mean like, were they able to get their food? How were they coping? Like, do we need to get social care involved? Like, were they able to look after themselves? Checking in on their mental health, making sure that they also knew what COVID was, and so that they were able to identify what COVID was. So we were sort of working alongside the GPs and the nurses to ensure that. Then it was also sort of, as we're going on, we're sort of in a sort of different time of when everything was relaxed, sort of around summertime. It was encouraging people to go out, so not to become reliant, because obviously COVID impacted not only NHS, but obviously our volunteers, our community as well. So when there was that relief, it was giving people the encouragement to go outside and sit in your gardens if you can, to really help their mental health. And now, obviously, we're in the vaccine side of COVID, which is great. The end is in sight, hopefully. And what that is that some of us have been calling up and booking patients in for the vaccine. We've been providing that information and support for patients if they've got questions. We've been working at the site, so help marshalling, help patients around to get their vaccine, or in like some very rare circumstances, like myself, we've actually been trained up and have been administrating the vaccine as well. Oh. So it's been really exciting, and I think it just shows sort of how exciting the role can be, working in primary care and obviously the community side. But yeah, I don't know what's going to happen next. I'm waiting for like the next call of, okay, you're going to be doing this now.
Well, I mean, it sounds like you've had to turn your hand to loads and loads of different things, and you know, that flexibility is probably something that everyone in the care sector has to have as well, by the sounds of things. The same question to Nathan, please. How's it impacted your job?
Yeah, it's been a big change for me. So yeah, when I first started, it was 18 months ago, just as an apprentice. Like I said, I was just running a freshly launched social care recruitment website. So the job was very much going out, visiting providers and care homes, and kind of just learning what their needs were, but at the same time finding out, you know, what we could do to help boost recruitment. And then, yeah, like I said, COVID happened, and we kind of launched a large campaign. So you may have remembered the NHS had a massive volunteer program that went out. So there was a group of us that kind of suggested that perhaps we could do a similar campaign for social care. And so we created a survey that was disseminated throughout the whole of London, that asked people whether they were interested in social care and whether they would volunteer their time during lockdown. And so we ended up getting 2,000 people. So it was a big adjustment. 2,000 people across London is a big adjustment for me, just going from 5 boroughs to 33. Wow. Getting all these people, and it became my job to kind of disseminate all the responses that we received to particular boroughs. So, you know, so we had 30 people responding from Barnet. We had a lot more, just saying, but I would then ship them out to the individual boroughs. And along with that, I mean, it was seen as such a big success. I kind of got seconded to London ADAS, who's now kind of in the we're creating something, like I said, a social care academy, something that the whole of London, ideally, is very much in the works, but a social care website that can pull together all the jobs, all the resources that people around London can go. So that's something that, just because, yeah, where I happen to be at the time, I've kind of been seconded as one of the most knowledgeable people in that area. So yeah, it's been a bit of adjustment for me.
Oh, that sounds really exciting. Perhaps you can share the actual name of that, and some of the people watching might actually be coming along to that website at some point down the line, hopefully. I just had a look at the Q&A, and we have some wonderful questions. I'm not sure whether we get around to all of them. I just wanted to start getting through some of them. So, I mean, one of the things, I mean, Louise, you said that you've been working in this sector for 38 years, which is, if anyone's going to answer this question, I'm sure you'll be able to. When working in care, have you ever had a moment where you thought you wanted to quit because it's got too stressful, or that you just couldn't complete your job because of what was going on at the time?
Yeah, most definitely. And I think anybody who tells you something different is a liar. It's really tough. And sometimes it's really hard. And I think during COVID, it's been really tough for the carers and the nurses that have been in adult social care. But the good news is that on the whole, most homes are really supportive places to work and have got really good teams that have pulled together and supported each other. And also all the local authorities and the NHS have pulled together to give lots of support into those homes to help people, particularly thinking about staff's mental health, because that's really important. But no, yeah, I've had many occasions where I've thought I'm going to jack it all in, and then people have come to support me. And I think that's what's key about the care sector. There's lots of people there who will support you.
That just goes on from what you were saying before, doesn't it, about the type of people who want to work in the care sector. I mean, if they are like you and like-minded, I'm sure they'll look after their own as well, by the sounds of things. That's wonderful to hear again. I just wanted, there's another question here. Why don't we ask, why don't we ask Caitlin, what is a typical day like as a social prescriber?
Yeah, sure. So the girls, or the social prescribers that we have in the team, we will have our own caseloads. So you receive referrals from GPs, and then you will spend the day contacting those referrals. So initial consultations obviously take longer than follow-ups. And so again, just listening to those patients, listening to their needs, and then finding out what support they have already and what more could be put in place. It's very obviously patient-driven, so they get to decide what they feel is best for their care, and then use this to help support them through that. So the day will be sort of a mixture of initial consultations for new patients and follow-ups as well. We have training regularly, so we put on at least training once a month for the team to keep up to date with their local services, and to fill any gaps they may have, especially with COVID. And so there'll be some training sometimes, and we also have like supervisions and peer support sessions often as well.
Brilliant. Thank you very much. Okay, so let's there's quite a specific one. Maybe either Louise and Nathan, you might be able to tell us this. It's, could you still do childcare and become a social worker, or do what? Or I'm not sure. That doesn't make sense. Sorry. Let's see. How long does it take to become a social carer or social worker?
Oh, do you want me to take it, Nathan?
Could one of you tell us that?
Yeah. So a social worker takes 3 years, and you go to university. But you can also do that through the local authorities as well. So through Barnet or Enfield or Camden. Sometimes they have programs on that are ongoing. So it's always good to check the websites of the local authorities. And a carer, it depends on what you want to do and the pace you want to go at. So it absolutely varies. So some people want to get on, want to do lots and are quite happy with doing lots of educational stuff, and other people aren't. Other people just want to take their time. So there's no rush for anybody. It's at your pace. And I think that's the key thing about being a carer. It's when you're ready to move to the next bit, you can move to the next bit. And there's loads of courses and things you can do there.
That's brilliant. Thank you so much. I'm having such a good time. I'm afraid that we're running out of time. I haven't checked the clock enough. Thank you so much for everyone. It's been really informative. I really want to hear more about your roles and about the care sector in general. Just want to say, if anyone has got any other questions, that they should go to stepintothενhs.nhs.uk, and I'm sure a lot of your questions will be on there. Also, these sessions will be recorded and will be housed on our side, on our website. Thank you so much to all our panelists. It was really, really informative, and wish we had some more time, and hopefully next year we'll be able to do this face to face, and everyone will be able to have more information and more time with you. Thank you so much, everyone, and yeah, I'll see you later. Thank you, everyone. Bye. And just to remind, before everyone that leaves, could you please fill out this quick poll on screen now? And okay, I think we're ready to finish the meeting. Thank you very much, everyone. Goodbye.
Thank you.
Thank you.
Thank you.
Goodbye,
Thank
everyone.
you.
Jake, am I going to get? Oh, he's gone. What did he say the Twitter feed was? Can you remember?
The Twitter, I tried to send that to you, but it actually wouldn't allow me to. I don't know why, but let me get it for you. It's
Okay.
MDX. It won't let me send it to you, sorry. MDX. ED. LIA. ISON.
ISON. Okay, hashtag, yeah.
Yep.
So Middlesex liaison, is that what it is?
MDX Ed Liaison.
Yeah, I've got it.
MDX at liaison.
Ed Liaison at MDX Ed
Oh, yeah,
Liaison.
yeah. Got you. Lovely. Okay then, thank you.
Bye, thank you.
Bye.
Have the rest of your day. Bye.
Nice seeing you, Nathan.
Yeah, good seeing you too.